So psychiatry often misdiagnoses people. What I mean by this is that there's no objective scientific marker to actually prove to anybody that they have a mental illness. So the way that mental illnesses are classified is they take individual symptoms, they group them together, and then they label them as a diagnosis of mental illness. So if we just take the most common quote unquote mental illnesses, for example, things like major depressive disorder, generalized anxiety disorder, and we look at the symptoms, things like being sad most of the time, having low energy, motivation, and emotion, a change in your eating or sleeping habits, a constant sense of anxiety or panic attacks. All we have to logically do is ask, are there not multiple factors that can cause a person to experience these symptoms? Of course, there are many psychological and biological factors that can make somebody present symptoms of being mentally unwell. The problem with psychiatry is that they take these symptoms, group them together, and then label you as if you have a specific mental disorder. Now, this would all make sense if they could actually scientifically prove to you that you have said mental illness. The problem, if you ask any psychiatrist to show you on paper, to somehow analyze your body and your brain and show you exactly where the mental illness exists, they cannot do it. At this point in history, this science does not exist. Psychiatry has no understanding of what actually causes a mental illness. So if we just follow this logically, they have free reins to basically take all these symptoms, group them together, label them as mental illness, as diagnoses, and then if a patient comes to them with any symptoms, they say, well, you have these symptoms, so you have this mental illness. The problem is that most patients trust the psychiatrists as if they're the experts, and most patients don't push back. They don't ask them, can you demonstrate to me that I actually have a brain disorder? Can you please show me on paper with scientific markers exactly where this illness exists inside of my body? And if they cannot do that, then we have to question all of the labels of psychiatry, all of the diagnoses. We have to question exactly how they're coming up with this information and how they're defining mental illness if they have no science to even prove that it exists.